did the years go so quickly, my love? How did we get to be gray? Decades go by in the blink of an eye. It still feels like just yesterday. The first time that I heard you say, love me forever and hold me right now. Gather our memories like this. I know we'll never be old anytime we reminisce. I'll be as young as you.
So in the meantime, we're going to set up some more chairs just so that we can accommodate some of our standing attendees. If you want to run to the restroom, take a quick break, you're more than welcome, and just come back really quickly.
We're running short time-wise, so we're going to continue on with our next speaker. I'm Tina Woods. I'm the Executive Director of the Geriatric Center here in Kerrville. We have a table out front so you can learn more about us, but we're essentially the senior center in our community and have started a new group called Dementia Care Advocates, which is aimed to raise awareness of the issues of dementia and provide education and support for family caregivers as well as individuals who have dementia. So please pick up some materials when you're out in the lobby. It's my pleasure to introduce Dr. Lena Rippstein to you this morning. She is an assistant professor and director of nursing here at Schreiner University. Dr. Rippstein developed and implemented the university's new Bachelor of Science in Nursing program, as well as a brand new RN to BSN program here. We are so blessed in Kerrville to have this higher education for our nurses. It's fabulous. She is a board-certified advanced practice RN and a gerontological nurse practitioner. She makes house calls and does nursing home rounds in Kerrville and San Antonio on weekends and evenings. So she's very much not only from the academic side, but the hands-on providing care side of nursing. She's a sub-investigator for the Texas Medical Research Association for their clinical trials, and also serves on nonprofit organizations in our community, including the Board of Trustees for Hill Country Cares, and volunteers with the Christian Women's Job Corps. Please welcome Dr. Rippstein. We had a malfunction.
Thank you, Tina, for your kind introduction. It's a pleasure to be here today, and I was going to share some of my research with you and then look at some solutions to how we might put an end to verbal abuse of residents in long-term care facilities and assisted living, that sort of thing, because as much as I would like to think it does not exist, that's not the case. We need to work toward that goal so that our elders will be treated respectfully in their final years. How many people work with, say, in long-term care setting? And assisted living? Home care, anything like that? Okay, so we have a good variety. And when I was thinking about doing this, as a study, what came to mind was I'd had several relatives in long-term care setting, and then they would report to me how they had been treated unjustly. And when the first time this happened in my family, I was not a nurse yet, and I didn't know that it wasn't acceptable. And it's people a lot of times are afraid to talk because, as some have said, I have to live here. They're afraid that if they report an incident that there might be repercussions to them. And so we need to educate our residents as well that there's laws to protect them, and things can be done to assure them that they won't be mistreated as a result of reporting. So why is it important? We do need to look at current practices, because a lot of times some of the participants in my study said, well, they talk that way at home, so it's just normal for them to talk to the residents this way. I wear my pajamas at home. I don't wear my pajamas to work. You have to set your private life from your professional life, separate the two, and ensure that we're acting professionally with our residents. It's important because baby boomers, I'm a baby boomer, there's a lot of us, and we're getting older. The population over 65 is going to increase by 71 million, or to 71 million by 2030. That's a lot of people, and if we don't do something to fix this, we're going to be a victim of it. So we really, really need to make an effort. And then, of course, abuse cases continue to rise. That's unfortunate, and often goes unreported, just like I said, because sometimes people fear that they will be punished as a result. So the purpose of it was to describe witnessing verbal abuse. I selected people who worked in long-term care settings. I did in-services, so it was a purposeful sample, and I did receive IRB approval at the University of Texas Medical Branch at Galveston, as well as the facilities. And there were 17 volunteers that came forward and wanted to be interviewed. So things I looked at their ages to see if that might make a difference. And there were people of all ages, from just out of school to people in their 60s that had worked for quite some time, and their level of education. I also looked at their experiences with abuse, and all but one of the participants had either been a victim of abuse at some point in their lifetime, or else they had a friend or loved one who had experienced abuse. I thought that was interesting. So it was 3 long-term care facilities in the San Antonio area. They were all corporate owned and for-profit. The beds ranged from 80 to 140. So I did interview them. I kept journals and made field notes and observations, that sort of thing, because it would make a difference. For example, if there was something going on at the time in the facility, if for example, if they were expecting the state to come to visit, or different factors, or if corporate was coming into town. These are all things that would change what was going on in the facility at that time. So what happens with elder abuse? A lot of times people quit eating. They become depressed because they're afraid. Sometimes they're afraid to sleep. They're more likely to develop pressure sores as well, because many times they're afraid to ask for help on, for their ADLs or something like that, because they are told not to. I'll explain that a little bit more in a little bit. There are higher mortality rates as well, even in the absence of chronic conditions. So it does make a big difference. It's all about the quality of life. And after interviewing these people, there were 5 thematic clusters that emerged, and it was common in each person I talked with, and that was sad. It was really sad that it's as prevalent as it is. So of course it was a small sample size, and it was only in San Antonio, and it's possible that their past experiences with abuse could have influenced their thoughts, but then again, that could be a positive thing, because maybe they're quicker to recognize something and more willing to stand up against it because of that factor. One interesting thing that did surface also on the abusers. Oftentimes, they were abused at home. And it's kind of like kicking the cat. And they, oftentimes it would be, it seems that people with dementia are often targeted because either they can't tell, or number two, if they do tell, nobody believes them. And that's very unfortunate. So the first cluster, it seemed like they put themselves in the victim's shoes. And Amy, of course, said, because one of these days you're going to be old, and you're going to feel the same way, and you're going to remember the way you treated these people. And Delia, it makes me angry. It makes me wonder why they treat them like that. I'm sure that if it were their grandma, grandpa, aunt, uncle, mother, or father, they wouldn't want anybody talking to them or treating them that way. So they really placed themselves in the victim's place, and they were more likely, when they did that, they were more likely to intervene when they heard something instead of looking the other way. Because as y'all know, oftentimes as healthcare providers, we're the only voice for many of our patients. And if we don't stand up and protect them, they have no one, maybe they don't have family members, or their family members are unable to help defend them. They also identified that many times there's just some people who don't belong in long-term care or working with the geriatric population, because yes, the 10th time that someone asks you what time is lunch, you still have to answer, without losing your patience, and it's okay. But maybe you need to ask them if they're hungry. Maybe they're just hungry and they don't know how to express that. So you could ask them if they wanted some crackers, or a sandwich or something like that, because it could be that that's what's triggering that question to be asked over and over. So Mary Ann said, I think these girls just don't have a heart for this job, because I've seen a lot of these girls that don't have patience. That's the one thing that you have to have with these kinds of people. They're old. They need your help. They also, with patients in long-term care and in assisted living, you become so close with them because you're caring for them day after day, and you really develop a bond with them. They become much like your family. Whereas in the acute care setting, many times someone's in and out in 1 day, 2 days, and so the relationship is totally different. And these participants in the study really described how they were empathizing with the residents. And Sandy said, sometimes they look sad or hurt. You can see the changes of looks on their faces and can feel their pain when they feel the pain. And then Dave, of course, talks about them becoming withdrawn. They become withdrawn to the point that they never want to ask for anything because they feel they're going to be yelled at. So that's more likely to lead to pressure ulcers, different things along that line, because they are hesitant to ask for the help that they need. It's hurtful. I get my feelings hurt too, especially when the resident, doesn't know what's going on, and they're just sitting there looking back at you and smiling. So we also identified the abusers as a bully. And the participants also felt that way. And like Patrice said, they go for the weak because they can't defend themselves. And then what Jason was talking about, things like saying, if you don't hurry up, you're not going to get to eat. Or if you don't take a shower, I'm going to force you. And I've seen other things through the years that, for example, one facility where I went, there was a sign in the back room, and it said, we talked with Mrs. Smith's son, and if Mrs. Smith won't do what you want her to do, then tell her that Fluffy, her cat, cannot come to live with her. And then the note went on to say, her son realizes that Fluffy can never come and stay, but he said it's a good way to get her to do what you want her to do. I couldn't believe my eyes. I could not believe my eyes. And I considered that a reportable event, and acted accordingly, because, you know, we can't do people that way. We can't tell them, if you don't take your shoes off right now, I'm not going to come and help you later. You know, it's unacceptable. And I think that education is the key to let people know that that's unacceptable. It's against the law. And if you're offended by this, I can certainly understand, but imagine if you're 85 years old and living in long-term care and someone says, you know, don't be fucking with me right now. You know, it's horrible to talk to anyone that way, much less one of our residents. And things like, you ain't the only damn person here, you know, there's other people. You've got to wait your turn. You're nobody special. So there was a large group of these people that were considered like warriors, because they would actually put themselves in between the bully and the resident in many cases. And I thought that was very interesting. Just like Irma, you know, heard something going on and went in and looked and stopped the abuser right then. And like Dave said, you know, when you take the position of a nurse, your responsibility is to protect the resident. And then Jerry, you know, came in and told her, what's wrong? Why are you screaming at her? And we have to be willing to intervene. And Mary Ann, she was such a, I still hear all their voices when I read these things, and the compassion that they had for the residents. And Mary Ann was one of the older participants, and she really had such a kind spirit, and just the nurse you would want to be caring for yourself or caring for your loved one. And you know, she says, like, sometimes I hear these girls and I go in and just tell them, leave this lady alone, go outside. If you want to tell somebody you want to be rude or something, come tell me, because I can defend myself. And then also pointing out to them that the things they were saying to the residents, the resident didn't understand what they were talking about. So then I looked at the essential structure of witnessing, and again, they were willing to make the stand, you know, take the stand to intervene and to protect the residents. And sometimes they were threatened as a result. They would have someone confront them out in the parking lot later on and say, you know, what do you mean? Why did you report me? Because you know, I got in trouble. And so they would try to turn it on the ones who intervened on behalf of the residents. So they were willing to take that risk, and they were proud to do it. In fact, they tell stories of sometimes through their careers where they worked with people who would mimic or make fun of the residents with dementia, and it was just like what they described. It was like games that were taking place at the residents' expense, And the last part where it says, and it means caring enough to do something about it. So I went back to him and I asked, what can we do about this? What do you think? How can we get this to stop? And across the board, it was in-services. And the in-services, we need to develop more in-services that talk about neglect and abuse. What is it? What is it? I don't know, maybe some people don't know, but they need to know. They need to be taught what's appropriate and what's inappropriate. And also in services that cover reporting, because if you're not willing to step up to the plate, then you're part of the problem, because you're also guilty of abuse in a passive form, because you're standing back and maybe giggling as well, or playing a part in it. And to teach healthcare providers that they need to report, that they need to stop. What they started doing at these facilities before it was over, they started saying to each other, "We don't do that here." And they felt empowered to be able to say that. And I saw them one day at the nurses' station. Someone was saying something, and one of the nurses looked at and said, "We don't do that here." And it really felt good that the heightened awareness was starting to catch on and make a difference, and that would improve the quality of life. Because the participants reported it happened. The bullies could be a position from a CNA, nurse's aide, all the way up to sometimes an administrator. And some of their questions were, okay, well, what do I do if it's my director of nursing, or if it's my administrator? They need to be taught what to do in those instances. And they all felt that more in-services, they even felt that bringing it up at every in-service, just to remind people, to put signs up too, "We don't do that here." And just to have that become part of the culture in the facilities. And then also educating people more on dementia, the process of dementia, so that they don't personalize it when someone keeps asking the same question over and over, that they realize that it's not they're not trying to bother them, they don't remember that they just asked. So you just need to answer, just like it's the first time that that they did ask the question. They also felt like having some teaching tools, a workbook that could be distributed would also be another option, and having policies in place and having everyone sign it, that they're aware. Other suggestions, they felt like intervening at the time was appropriate, and to educate on the need to report, to hold each other accountable. Because sometimes it's off down the hall and someone's given a shower and maybe they're not talking respectfully to the person that they've got in the shower. And we need to be willing to step up to the plate and intervene on behalf of the resident. And so as a result, they felt like the culture change would take place with additional in-services. We also need to educate our legislators. I try to do that a couple of times a year in DC, and then I was just in Austin recently. We need to let them know about what we need to have in place for patients with dementia, because it's a growing problem, and it's just the tip of the iceberg right now. Because as those charts showed earlier with Dr. Behindley and Goldman, that the older you get, the higher prevalence for dementia. And that, you know, we need to educate the workers, including administrators, medical directors, and the DONs. And now I'm ready for any questions. Yes, ma'am.
Many of the people that you interviewed discuss limitations that they felt the workers at the facility had to responding in appropriate ways, such as just environmental limitations or anything like that?
I didn't hear the last part.
Environmental limitations or just reasons other than ignorance or lack of education that it might be happening.
They felt like with the stress, high stress, if the workload is too heavy, that sometimes they would be in such a rush that they would be shorter with people, and also the fact of what their home life was like. They over and over they mentioned that the ones who were the bullies were victims at home. Yes, ma'am.
This isn't really a question so much as I really like that phrase, we don't do that here. It's so less accusatory. There are many things, and it can be used in so many venues, not just in
Yes.
nursing home, but I really like that.
Thank you.
Could you repeat what they're saying because we can't hear everything?
She was saying she liked the idea of saying we don't do that here because it's less accusatory, and it helps create the culture that is what our seniors deserve, which is respect. Yes, ma'am.
I go into a lot of these facilities and I see that, you bring it up to whoever, whoever's there. Is there a step above that?
If it's long-term care facility, there's a state, well, you can report to the state for long-term care, and then there's also the elder abuse hotline. But you can, they'll do a surprise visit on the facility, and sometimes that's what's needed. Assisted living, same thing, there's regulatory, and then also the elder abuse hotline is, it's typically posted, it should be posted in every facility, the hotline, because my fear is that if it is just reported to, for example, the DON or something, they may be aware of it anyway and rationalize it all out and just not create the changes that need to be. Yes, ma'am.
What if it's a concern or a question, not so much an accusation, or that you want to make an official, formal complaint? Could you just go to the ombudsman?
Yes. Yes, ma'am.
Can you just quickly summarize earlier in one of your slides the 5 themes you probably touched on, but just quickly list what were the 5 themes that you recognized in the study?
Okay, the first one was witnessing as becoming the victim, placing oneself or significant other in the victim's shoes. Witnessing as perceiving that certain staff do not belong in long-term care. Or, you can generalize that as well, certain staff don't need to be taking care of jury population. It's not always an easy thing to do, but it's the most rewarding thing that I've ever done in my life. Witnessing is reading the victim, and that's when they're looking at their faces and seeing the pain a lot of times, the helplessness. And witnessing is reading the bully. And witnessing is becoming a warrior. Other questions? Yes?
Well, are there in the nursing homes in these facilities Our professional reviews would not be part of a program of feedback from patients, families to do that.
Right. But one of the barriers is that a lot of times people are afraid to report because they either fear that there will be retaliation or else that if they say anything, then, and of course I didn't interview any of the family members, but I've heard family members say to me as a nurse practitioner, we don't want to cause any waves because mom or dad would have to move, or something along that line. And if you've got someone who has special needs that facility is able to provide, in my opinion, it's still not a good reason to stay in a bad situation, but sometimes the families overlook some things. And then it could be that that's going on when the families aren't around. And it's more the workers that are side by side that hear things, because then the healthcare worker, when the family members are present, typically are going to speak differently toward the resident. Yes.
So what's the protocol when you find that it's the family members that are
And that's when you call the hotline. Mm-hmm. And I would report that to the facility as well, because that happens too. Sure it has, unfortunately. Mm-hmm. And then, that goes on into other forms of abuse, the financial, and all sorts of things. It's a problem. Yes, ma'am?
Are staff, maybe like if a staff is with the same patient all the time, are they moved around so they don't get?
I can just speak to the facilities that I typically go to, and a lot of times people kind of stay on one hall or one area or something like that. It might be, right, it might be a benefit for all. But then, the residents oftentimes become so attached to their provider because, they become, right. Other questions? Yes.
One of your slides mentioned role-playing as a form of education for staff.
Yes.
Do you have any programs that you could refer us to, or an example?
I don't know of one that exists right now. I've been intending to work on that and get that kicked off. So that's one of my projects that are coming up. But we need to, I think role-playing is very effective. And there's a number of ways to do it. If you want to get with me later, let me see. Whoops. I've got my contact information there, and I can give you some guidance on that. I'd be happy to. And ma'am, your question.
Yeah, your study, identifies the fact that there is the verbal abuse, but I think you've probably known that has been going on for several years, obviously, in long-term care and assisted living and extended care facilities. But did your study shed any light on why it continues to happen? We know why.
Why it continues to happen?
Yeah, why is that a continued theme in these kinds of facilities? Well, we've known this for quite some time. What is not happening? And did your study shed any light on what is not happening as to why these things continue?
Since I did not interview the bully or the bullies, it's difficult to say. The participants that I did interview felt like the stress in the home life, you know, both on the job stress and stress at home, were major influences on things.
So I'm going beyond the person perpetrating the verbal abuse. I'm talking about, obviously, there has to be the administrative faculty know that these kinds of things happen. So what needs to happen, or does your study indicate what is not happening as far as why this hasn't been addressed today?
You know, that's a difficult one to answer. What she's asking is the administrators must be aware that this sort of thing takes place, and so what can be done, and maybe it's just explaining, maybe through in-services, to explain to them what what their duties are, because I think a lot of times it's easy for people to rationalize, oh well, you know, they don't do that all the time, or you know, that was just a one-time occurrence, or something like that, and that's okay. It doesn't matter. It shouldn't even happen once. So I think probably some kind of workshops that focus on this for people in administration would be helpful. Yes, sir.
Lena, the Department of Aging and Disability Services, through the Ombudsman program, has units of instruction that our ombudsman, I'm with ACOG, currently do with nursing homes and assisted living. They're limited by the number of volunteers and the number of ombudsmen we have, but they do exist out there.
That's great to know. He's talking about the ombudsman being an excellent resource, that they have materials and different things that would be beneficial, and also that there's a shortage of volunteers. So where would someone, how would they go about volunteering?
They call 866.
Call 866.
231-4922.
231 4922.
Just look up ACOG.com.
ACOG. AACOG.com. If y'all are interested. It's a very worthwhile. Yes, ma'am.
The issue of this population increasing at huge rates, what kind of responses are you getting when you go to the legislators about resources? Because we all know that one of the problems is there's no money in
No money.
work. Mm-hmm. It's hard. High turnover. It's hard work. Sometimes would you rather work at Burger King or would you rather work in a nursing home? It's considered the same level of work, and that is unacceptable.
Mm-hmm.
The resources have got to be there.
Right.
And what is happening?
It's a problem because, for example, we've said it for some years. It's like when in long-term care, when Burger King gets a 25-cent an hour raise, everybody runs over that direction for a while. You know, they're trying to survive. The people are just trying to survive and earn a living wage. But the legislators are very supportive. You know, but
So where's the money?
where's the money?
I mean,
Good question.
it's just completely unacceptable
Yeah.
that Burger King and CNA are the same,
Right.
considered the same type of work.
Right.
That is not acceptable.
Mm-hmm. Okay. Yes, ma'am.
I realize that the abuse part of it is extremely significant, but, I think that the administration has to develop a no tolerance,
Absolutely.
a zero tolerance
Absolutely.
for that type of behavior. And, people need to, I suggest that they develop some type of a way that people can report that type of information anonymously, but the person that's a perpetrator, even if it's overhearing or whatever, would be able to get some type of help
Yes.
managing, you know, their anger or their home life or whatever, because the situation isn't going to get any easier. It's not going to get any better, but you really need to have competent people in place to take care of our population.
That's right.
As we begin to age. And so, you know, just kind of developing the pillars of caregiving and what are our expectations, and we cannot accept less.
That's
we
right.
really can't, because it could be you or me.
That's right.
You know?
And will be. Will be.
Exactly right. You know, and so there really has to, something has to happen, you know, in order to move forward in this and to help our caregivers develop them, you know, to being the caregiver that they can be. You know, I don't think that it's a shameful thing to care for others. That's really, I think we need to exalt that a lot higher, just like with our teachers.
Absolutely. And I agree, zero tolerance, even if it's the first time, you know, instead of saying, oh, well, it's the first time, you know, you have to act on it.
For retaliatory behavior on the part of the employer.
What, I'm sorry, repeat that?
Zero tolerance
Right.
for retaliatory behavior on the part of the employer. That, for blowing the whistle, if you will, that's unacceptable for them to be fired for reporting verbal and other abuse.
Right. And back to your point on the re-education of the bullies. That's what the participants were indicating as well, as far as in the in-services, that they felt like that knowledge is power. And it, of course, you know, it could be that a more intensive program would be needed for someone with a bully mentality.
Dr. Rippstein, also, I just want to add to that because I think that's really important. I think legislatively we need to start making some changes as to the number of clock hours or training that's required to work in this population. With CNAs, it takes less time to become a CNA than it does to become a barber in the state of Texas,
Yes.
and also a nail tech and a manicurist. And you know, same thing. So I think that's part of the issue. But also the training it's not just for CNAs. I think there's a lot of people who work with older people who really don't even have a clue about what gerontology means.
That's true.
And that includes nurses, RNs, LVNs, social workers, OTs, PTs, who just kind of get into this generalized training of a multidisciplinary approach, and they don't really have any clue. And that doesn't even include all the issues that are going on in their own life. And remember, there's a difference between a job and a profession.
True.
Some people just go to work so they can buy groceries and pay their electric bill. Other people have a career. They have career plans. They move forward. And so studies have shown already that those distinctions between someone who just wants a job versus someone who wants a profession, their perspective on their employment is much different. But I think we have to start forcing people to have a certain number of hours of education before they can start working with elders in any capacity, especially when you start having some of the functional and mental disabilities that are occurring. So I push for that. I think that's where we're failing right now.
Those are excellent points. Yes. Okay, well, I think I'm out of time. He just gave me the sign back there. So thank y'all very much.
Where did the years go so quickly, my love? How did we get to be gray? Decades go by in the blink of an eye. It still feels like just yesterday. The first time that I heard you say, Love me forever and hold me right now. Gather our memories like this. I know we'll never be old anyhow. Anytime we reminisce, I'll be as young as your kiss.